So this is a slide that I added just to highlight some issues for patients and staff. So this happened just recently. You know, I think we take for granted that we live in New York City. Everyone's like, oh, this is a very liberal city. This is a very open environment. Everyone's, you know, really up to date on progressive issues, LGBT health concerns. You know, why are we worried about this? It's New York. You know, this isn't Texas or the Southwest, maybe some parts of the country that are maybe less accepting. But just a couple of years ago here at New York Presbyterian, a comic, I don't know if anyone's ever heard of Judy Gold. She's a comedian. She's been on some TV shows. She and her partner at the time were raising a son, and he was cared for here at New York Presbyterian. And she wrote an op-ed piece in the Huffington Post about how the care that her son and the family received was less than ideal. So as I mentioned, her son was hospitalized for a tonsillectomy for treatment of his snoring. And while he was under care at the hospital, they were inundated with forms and questions pertaining to Ben's father. Barriers to visitation were posed to Judy Gold's partner. They would receive phone calls following their stay, asking to speak to his father when, you know, she had constantly reiterated that there was no father in his life. So as a result of that, and the op-ed in the Huffington Post, New York Presbyterian kind of like sped up efforts to make at least in the pediatrics department, their intake forms in their department more inclusive of same-sex parents. So it just goes to show you that even in New York City, I think we take for granted that everyone's up to speed on what needs to happen. And just keep in mind that New York City is a city of immigrants historically, and while some of us may have been raised in the US and have been very up to date and aware of these issues, we may have colleagues or patients that come from countries where their awareness and their compassion for this community is not similar to what we're used to here. So it's always good to, you know, continue training hospital staff throughout the hospital, new hires and current workers. So I wanted us to think about, you know, what we can do. Like what can you do to make your patient or a colleague feel more comfortable at the institution or at your academic health center? So I made this example of a patient, and you don't have to be a provider to answer this or to participate. You could just think of this person as a person you're meeting at a party or a person you're meeting at work. How do you phrase questions to get to know someone, get to know about a person's sexuality, their gender identity, who they are as a person? And I used the classic example of a patient visiting a doctor and how you could phrase questions to help them reveal more about their personal life. So I gave the example of Chris, who's 42 years old. He comes to your clinic for a general checkup. He just moved to New York City, is establishing care at your site. What are some questions that you would ask him to get to know him better? Anybody?
So just in terms of social history, instead of just making sure to be inclusive and non-discriminatory in saying, do you have a husband, a wife, or partner, or not assuming gender of the person's partner?
Mm-hmm. Okay. So do you have a husband, partner? Mm-hmm. Okay. Anybody else? Thinking about if you're seeing a patient or if you're just at a party getting to know someone, how do you phrase questions to be as inclusive as possible? Okay. Who do you live with? Any other examples? Maybe like, who do you include in your family? Who are the members of your family? What about in terms of gender identity? Like, we don't know Chris's gender identity. Has anyone found a good way to explore that with a person?
You can ask if they have a preferred pronoun. How would you like me to refer to you?
Okay. Yeah. Do you have a preferred pronoun? How would you like to be referred? He, she, or something else? or preferred name. Sometimes the name a person's assigned at birth or a name they're known for is not necessarily the name that they wish to be called by. What about in like clinical settings? Has that ever been an issue for anyone, kind of sorting out a patient's gender identity? I think in general, I think for me, talking about sexual behavior or sexual orientation is easier than gender identity. I think for me, what I've done is, patients often register and fill out forms, or a nurse will fill out information about a patient and document it. And I may just say to an individual, oh, I see that you completed this registration form, and the nurse completed it for you. Are there any fields in the demographic information that may not be accurate or reflect who you are? So like, for example, like I see that you listed male for gender identity and white for race ethnicity and straight for sexual orientation. Is all this information accurate, or is there something you'd like to add to that? And kind of leave it open for them to add to it, and maybe not directly ask them, oh, what is your gender identity specifically? Because it could potentially put a patient on the defense or feel like they're singled out. So, and then, it's up to you about how you feel most comfortable presenting these questions and information. So I just gave some examples of inclusive communication skills, like who do you live with? Are you currently in a relationship? With whom? Who do you include in your family? Do you have a partner or spouse? Can you tell me more about them? You can start off these questions with, I ask all my patients. In a clinical setting, you may say certain medical conditions are linked to sexual practices. Hence, I'm going to ask you these questions. And as we mentioned, use the pronoun that matches the person's gender identity, and just having normal social grace. If you slip up, apologize, and move on. And just if there's a question about how the patient or the individual wishes to be identified, just clarify that with them. So what are some health concerns within the community? What have people heard about? What are some classic health concerns for gay men, lesbian women, transgender individuals, bisexual individuals? What are common things we know about? Anyone heard anything? Do we have any health needs? Are there any health needs?
There's I think there's a higher rate of suicide and drug use in the LGBT community.
Okay.
A lot of lesbians don't do some of the gynecological follow-ups because they're not intended to bear children. So a lot of times they neglect that part of their health care.
Okay, so we mentioned suicide. Under that, we can include mental health as an umbrella term, drug use, substance abuse. We can also include like alcohol, nicotine. And you mentioned the third one was kind of access to care, or maybe avoiding care, either because fear of being discriminated against or fear of providers not being aware of health concerns. Did I get all that?
Like you said, misinformation. I'm not going to bear children that I don't consider.
Okay. Okay, so maybe patient knowledge about what's appropriate screening for themselves. Okay. Great. Any other health concerns?
Violence.
Okay. Violence, such as?
So rape is one. Self-violence, self-harm, cutting, which kind of goes alongside with mental health issues. Bullying, so especially in pediatrics, is a big concern.
Okay. So we mentioned violence, be it hate crimes, maybe domestic violence, cutting, so falling under the umbrella of like mental health or depression, anxiety, suicidal ideation. And the third one more time? What was the third thing you mentioned?
Bullying.
Oh, bullying. Okay. So that again falls under violence. Mm-hmm. Any other health concerns?
Identity and transitioning, especially with hormonal treatments. And even now in children too, they're also thinking about hormonal treatment with kids, and it's getting very tricky and ethical issues involved.
Okay. So that sounds like under like transgender health concerns. So issues with identity, and if someone's interested in transitioning to what extent they wish to transition, either with medications or with surgery. Everybody's different, so people choose all of the above or just parts, what's appropriate depending on their age, depending on their emotional support, their family support, mental health support. Great. Okay.
And then also where they're getting their care. You know, are they getting it from licensed healthcare practitioners, or are they getting it from the street or the black market and things like that? So it's something to think about when you're thinking of hormones, because a lot of people, you know, always come to a hospital or a clinic.
Okay, so I'm just going to provide a general overview of some health concerns. So just in general for the entire community, so access to care. And what are some potential barriers? So there are questions about insurance coverage. Historically, LGBT individuals have found it more difficult. One reason being they weren't able to get married. So a lot of individuals get insurance coverage through their same-sex partner, right? So if you're married, you can get insurance through your spouse. In the past, that wasn't possible, but now that things are changing, access to insurance should improve, and hence access to care. Registration forms at your hospital. So most academic health centers and clinics don't collect information, any information on sexual orientation or gender identity. And as a result, it's very difficult to identify health disparities in the community. A lot of the research has been less than ideal. A lot of research has been collected through like convenient sampling, or going to a bar or an online form and trying to assess what's going on in the community, which is less than ideal. You know, ideally, if we can have everyone identified through the electronic medical record or the registration forms, in the future, over time, over several years, we can really see, are there, does being lesbian, gay, bisexual, transgender, does that pose a greater risk of certain cancers, certain infections, heart disease, mental health? But that's something we haven't been able to do in an ideal manner because the EMR is not inclusive. Medical decision making, and this again goes in line with being able to get married. Like, who is making decisions for you? In the past, if your same-sex partner wasn't recognized by a hospital or a clinic and a person became very sick, they would often defer to a family member or your parents or a sibling, and the partner would be left out and wouldn't have any input on end-of-life care or major medical decisions. I mentioned that the research on health disparities in the community has been less than ideal. Non-disclosure of LGBT identities, either because a patient doesn't feel comfortable, for whatever reason, disclosing their identity, or a clinician isn't getting the information. A patient may be ready, but a clinician's not asking the questions, or they don't know how to ask the questions. So it can go both ways. And then just training our workforce goes along with training our providers, our nurses, our staff, people at registration, our doctors, training them to take care of members of the community. And that is something that, to date, we are still working on. Okay, so health concerns specific to the community overall. So we mentioned substance abuse, be it alcohol, nicotine, legal or recreational drug use. So data has shown that individuals in the LGBT community have higher rates of dependence on alcohol, tobacco, and drugs. Regarding cancer screening, a lot of data has shown that due to historical discrimination, LGBT individuals avoid screening procedures, avoid going to the doctor, avoid going to the clinic. So as a result, they're not optimally accessing preventive health screening. So it's not so much that being LGBT means you're at greater risk for cancer overall, but avoiding getting screened could lead to delayed diagnosis, delayed care, and poor outcomes. That makes sense? There isn't much data on cardiovascular disease. Some people hypothesize that due to greater emotional stress, emotional distress, being LGBT, this may pose an increase of cardiovascular disease. But again, this is still theoretical. This hasn't been borne out by the data. Data has shown that LGBT individuals suffer from higher rates of anxiety, depression, higher rates of suicidal ideation and suicide. And also data has supported higher rates of violence among LGBT individuals, be it hate crimes. In terms of domestic violence, actually the data has been comparable to heterosexuals or cisgender individuals. Being LGBT doesn't pose a greater risk of domestic violence. It's very similar to other communities.